I'm Dirk Lambrechts, CFO and CIO of Europe Hospitals in Brussels. The hospital has 716 inpatient beds. We treat about 1,000 consultation patients per day. We have emergency services. We were confronted with obsolete technology. We decided that we had to change, that we had to make a new start, and we started over from scratch. But starting from scratch means that you have to develop a vision on what type of network, what type of infrastructure you are going to build. We wanted something which was completely IP-based. We looked for were also those things that made us independent of the technology or the solutions. To have an open infrastructure, gain money on in an hospital, is to cut into the logistic process. This means that we wanted to computerize everything and to robotize even, but spending money, investing in robotization, which cost a hell of a lot of money, without integrating this up to the bed of the patient makes no sense. So we looked for a solution who made things like that possible. When you go for a from-scratch approach, you need a partner in which you have confidence. We chose for Alcatel-Lucent to help us to define a network infrastructure which could give an answer to all our needs. But the advantage of Alcatel-Lucent was that they had solutions for voice and for data, which we didn't find amongst the other players on the market. Since you know that you will have to address difficult technical questions, it's important to have one partner which is covering the whole spectrum. The most important thing for me is that in this moment we have a fully link and a fully integration of the whole process of linking the medical file, including prescriptions, to the care given bedside. The advantage of linking patient records and all the data together is that you avoid mistakes. The most common mistake in hospitals are medication faults, errors. So linking up Wi-Fi, cellular phones to one solution with tandem configuration, so that in fact every phone is always ringing, we were able to find a solution for the most difficult problem to solve, the availability of our doctors on the spot. It's important that people feel that with the technology that we are putting in place, they have advantages for themselves. Patients want to do more. They want to have an entertainment system in their bed if possible. And the technology is there on the market. So the possibility, for instance, to give to our dialysis patients an iPad on which they can not only watch television, but also play or chat or go on the internet is one of the things that are very warm welcomed by our patients. The main advantage of the vision we developed and the technological solution we put in place is that in the long run, getting rid of the concept of the device as such makes us in a way future-proof. It means also that for people working with us, our patients staying in our hospital, they can be assured of the fact that they can do those things they are used to do, and they are not dependent on one or another IT guy deciding for them what they should or shouldn't do when they are in our hospital or when they are working.